Now let's talk about chest compressions. Chest compressions are the most important step in CPR. So this will pump oxygenated blood into the vital organs of the body. So the most important step in CPR. That's why it's very important that you should know the proper positioning of the hand when you apply or when you do chest compressions. Now perform chest compressions with two hands for an adult. So this is, you need to use both your hands. The dominant hand, okay, must be the one that is under, okay, and then the non-dominant hand over. So meaning it is the stronger hand that must be the one that comes directly in contact with the patient's chest. Now, one hand for a child, you can use one hand for a child since the chest of a child is still fragile. Okay, so we don't want to fracture the sternum and the ribs. And of course, if it's an infant, you will only be using two fingers. So you do chest compressions for an adult and a child. You do chest thrust, okay, for an infant. Now, effective compression requires the rescuers to push hard and to push fast. Okay, that's why when it comes to doing the compression, so you do chest compressions. Two chest compressions must be done in 1 second. That is how fast the chest compressions must be done. Okay. Now, chest compression. The chest of an adult should be compressed at least 2 inches. So that should be the depth of compression. Okay, so the chest of a child is still 2 inches, but the chest of an infant should be only 1.5 inch ang depth of compression. Okay, so mas dili ta mo put og we don't compress an infant's chest that much, okay, compared to the adult and the child. Again, for the child, it will also depend on the structure, the body structure of the child. Okay, kung gamay sad siya nga bata, then we don't really give that much depth of compression. Okay. The desired location for chest compression is always the center of the chest. So what is this on the central part of the chest? That's your sternum. Okay, now be careful so as not to position the hand at the xiphoid process. So the xiphoid process is actually located at the tip of your sternum. So you don't position your hand there because that could cause fraction of the xiphoid process. So xiphoid process is just the tip, no? It's a bone at the tip of the sternum. So that could easily be fractured. So how do we know, how do we make sure that our hands are actually positioned properly at the center of the chest? So it is actually in between the two nipple. Okay, so the nipple line and then center point of that is now the central part of the chest. Now give chest compressions at a rate of at least 100 times per minute. Okay, 100 times per minute for all victims. So the same for all victims. It is just the depth of compression that is different. So at least 100 times per minute. So meaning one cycle is equivalent to 30 chest compressions, okay, and 2 rescue breath. Okay, so one cycle is 30 chest compressions and 2 rescue breath. So if it's at least 100 times per minute, so you should be able to give at least pila ka cycle, 3 to 4 cycles or 4 cycles, okay, in one whole minute. And how many rescue breath? That's 8 rescue breaths. Okay, so we need to take note of this. Now, when do we stop giving CPR? When is the time no nga pwede mo stop og CPR? Or when valid mo stop in giving CPR? So first is when your AED becomes available. So let's say for example, it took some time for you to be given or for the AED to arrive. Then you need to continue CPR because again, 4 to 6 minutes without CPR could cause damage to the brain. Okay, now 8 minutes, Okay, 8 to 10 minutes without CPR, that could cause permanent damage to the brain. And 10 minutes above, that could already cause the death of the patient. So that's why we need to give CPR immediately. You must not wait for the AED. Kaya wala dahil if they are not able to secure AED immediately, then you need to proceed with CPR. Okay, now when once you started CPR and then there is already an AED, then you stop. That way the device could analyze the heart rhythm, and that way we will know if it needs to be shocked or you just need to continue doing the CPR. Okay, now second instance when to stop giving CPR is when the victim already shows signs of life. So after a minute of giving compressions, chest compressions and rescue breath, check again the pulse, check the breathing. Once there is already a pulse and or there's already breathing, then that's the time that you stop giving CPR. Okay, so stop giving CPR and then you do the recovery position. Okay, so a recovery position na to si patient that or si victim, that way continue na makaginhawa siya og tarong, and if ever mo vomit si victim, then that will be the best position. Okay, third one is when the emergency or the medical team has arrived. Okay, so meaning they will now take over the whole situation. Okay? So sila na ang mo continue. If you started giving CPR, then they will continue giving CPR. So you need to stop. Or when you are too tired to continue. The first aider is already too exhausted to a point nga siya na pod ang hapit makuyapan na. Then we don't want that to happen. You also need to think of your own self. You need to think of yourself. Kay basin, ikaw na pod ang manginahanglan og CPR later on. So, if you feel like you're already too exhausted, try to ask if someone could take over, or if there's really no one who will be able to take over, then you stop. It's valid. Okay? Okay ra gyud na siya. You must not risk no ang imuhang self. Now, interruptions and chest compressions should be kept at a minimum. So guys, dili gyud na siya ingon nga, let's say for example, especially with the counting, there are really times, because in an emergency situation, there are really times it's normal nga ang atong focus murag mawala tano, and then ang atong pagkakalma makuan, no? Especially if you look at the response, no? If there's really no response from the victim, then interruptions of chest compression, okay ra na siya, but it should be kept at a minimum. Dili kay pirmi na lang sa ka na interrupt. Okay, so it's very important you need to focus. That way you will be able to think as to what to do next. Okay, and you'll be able to think how to do the procedure properly. Now, another skill that you need to have when it comes to doing the BLS is your rescue breathing. So what is rescue breathing? It is a technique of breathing air into a person to apply or supply him or her with oxygen needed to survive. Now, how much oxygen are you able to give to your victims once you give your rescue breath? You are actually giving 18% of oxygen. It's not that much, but it's enough, no, for the victim to survive. So, bisad pa gamay-gamay lang na siya, but it's enough. No, pwede na makatabang na sa victim. Now, when you give your rescue breath, it's very important that you need to open the airway. So, how do we open the airway? You tilt the victim's head. Okay, tilt the victim's head up, lift the chin, draw thrust, and then you give your rescue breath. Don't forget pinching of the nose. Why do you need to pinch the nose? That is to make sure that the air will enter. No, tanang hangin mo enter, walay hangin nga maka-escape. Okay, so with the airway open, pinch the victim's nose. That's for adult. But if it's a baby, then your mouth should seal the baby's nose and mouth. Okay, so lahi na siya. So for adult and children, you pinch the nose. Okay, head tilt, chin lift, jaw thrust, pinch nose. That's for child and adult. But if it's for a baby or an infant, then you don't need to pinch the nose, okay? Because your mouth will seal the baby's nose and mouth, okay? Now, give one breath one breath lasting for 1 second, and then you take 5 seconds, no, to gasp some air, and then give another breath. 1 second rescue breath. Okay, 1 second, gasp some air, good for 5 seconds, give another rescue breath, good for 1 second. Okay, so do not do rescue breath, give it too much rescue breath to your victim. Why? Because this could cause stomach distension. Okay, di sad palabinan. Okay, basig mo boto yang tiyan. Okay, limit the force. Okay, just limit the force enough to let the chest rise. Okay, so ingon ana sad ay sad palabani. Okay, so you should also learn to assess the victim kung how much air ang gikinahanglan niya. Okay, ayo sa pabulhuti og maayo. Okay, because that's too much. That could cause stomach distension. Okay, so this is how you position, or this is how you open the airway. So you tilt the head, no? Chin lift, jaw thrust, look at the hand, no? So it's holding here at this part to open the mouth, and then you pinch the nose. And that is how you give rescue breath to an adult. Now this is a child. It's the same. You pinch the nose, lift the chin, pinch the nose, no? Open the airway, give the rescue breath. And this is now for the infant. So as you can see, there's no pinching of the nose, but rather the mouth of the first aider or the rescuer is actually the one that's sealing the nose and the mouth of the baby. Okay, so that is how you give the rescue breath to babies. Now, 7 ways to ventilate the lungs. So we have 7 ways to ventilate the lungs. First is mouth to mouth. Okay, that's the normal. Now, when we give rescue breath to an adult or to a child, this is the most effective way to provide oxygen and ventilation to the victim. We also have mouth to nose, which is usually given to infants. You have mouth to nose. Okay, so when is it recommended? So when it's impossible to ventilate through the mouth. Okay, meaning the mouth can't be open. Okay, so probably basin there's injury to the mouth, so you do mouth to nose. Ari ka sa ilong mag-give a rescue breath, or the mouth is seriously injured, or unsa man tight, no, nagtighten ang mouth. So you can also give mouth to nose. You also have mouth to stoma. So if there is a stoma for those with tracheotomy, who underwent tracheotomy for breathing, so instead of giving the rescue breath to the mouth, you give it through the stoma. Mouth to face shield. Okay, so there's a face shield ni patient, so you give it to directly. No, you give rescue breath direct to the face shield. So this is used to provide rescue breath for patients with clear plastic placed over the victim's mouth. You have mouth to mask, no, used to provide rescue breath for patients with a transparent mask. You have the bag mask device. So let's look at the picture. So this is mouth to mouth. This is mouth to nose. Mouth to nose. Okay. And then you have mouth to stoma, which is on the neck. Okay, so kana sa stoma siya nag-give a rescue breath. Mouth to face shield. Okay, there's a face shield over. Mouth to mask. So kita no, during the pandemic, no, as we practice CPR, we use the mouth to face shield. Okay, so, or the mouth to mask. So you can purchase this one if you like, but this is a bit expensive compared to the face shield or the plastic shield. You also have the bag mask device. Okay, so now in our next video, we will be doing the choking care.